Hi, everybody. Good morning or good afternoon, depending on where you are. I am Dr. Vale Wright. I am the Senior Director for the Office of Healthcare Innovation in the American Psychological Association. And we are so excited to have you here with us today for our webinar, Understanding Digital Treatments, Why All Mental Health Apps Are Not Created Equal. We have a great set of speakers here today that I have the pleasure of introducing. I will serve as your moderator and also your first presenter to kind of kick us off, but I'm also joined today by Dr. Jenna Carl and Dr. Stephen Schuler. Please allow me a minute to read off their bios because their expertise is so impressive, and I just really want to make sure everybody is aware of just what a great group of speakers we have today. So Dr. Jenna Carl is the Chief Medical Officer at Big Health, where she advances the company's clinical strategy, an industry-leading body of clinical evidence that validates the safety and efficacy of its digital mental health treatments, Sleepio, Daylight, and SparkRx. Responsible for a team of psychologists, researchers, medical affairs, and regulatory experts, Dr. Carl leads Big Health's development of digital treatments for high prevalence, poorly treated mental health conditions, and was the clinical architect of the company's Daylight treatment for anxiety. A practicing clinical psychologist who specializes in the research and treatment of anxiety, depression, insomnia, and related mental health disorders, she has developed multiple novel cognitive behavioral treatments for anxiety and related disorders, including both in-person and digital treatments. Dr. Stephen Schuler is an associate professor of psychological science and informatics at UC Irvine. He directs the Technology and Mental Health Lab and is a member of UCI's Connected Learning Lab. As a clinical psychologist and mental health services researcher, Dr. Schuler's work focuses on how technology can improve mental health services by expanding access and improving accessibility. This includes the development, evaluation, and implementation of digital mental health products in diverse settings and populations. His research has been supported by the National Institute of Mental Health, the Jacobs Foundation, One Mind, Pivotal Ventures, and the Robert Wood Johnson Foundation. And as I said, I'm Vale Wright. I've been working for APA since about 2014, but for the last 3 years, I've been overseeing the Office of Healthcare Innovation, which really focuses on how we can use technology and data to address solutions within healthcare. So that includes increasing access, measuring quality outcomes, and increasing efficiencies across all levels of the systems of care that we work in. So I'm very excited to be here today and to talk to you about this. Just a brief overview of what our agenda looks like. So I'm going to start off talking about the digital health landscape. Then I'm going to turn it over to Dr. Jenna Carl to talk about the role of clinical psychologists in the development and delivery of digital interventions. And then I'm going to switch to Dr. Stephen Schuler, who's going to talk about the evidence and the evaluation criteria. And I promise we're going to leave plenty of time at the end for Q&A. So if you haven't already started to, please make sure you locate where your Q&A box is so that you can enter your questions in there and we can answer them at the end. So it's not going to surprise anybody on this webinar when I say that this country is in a mental health crisis that's only been exacerbated since the pandemic. And while we need to continue to support and expand our existing workforce, we also know that we'll never have enough providers, no matter how you chalk it up, to cover the increasing demand for behavioral health services. And so what's this left us with is patients are struggling with access challenges for mental health care. And unfortunately, the data bears that out. We know that the primary point of access for most people for mental health is your primary care doctor. And because of lack of resources and lack of time, often their first line of treatment are medications. And now there will always be a role for medications in treating mental health disorders. It's not always the right first line treatment. We also know from patient preference surveys, it's not always what patients want. 75% of patients say they would prefer a psychological treatment option, often talk therapy. But when patients try to seek those out, they're often unable to find providers with openings. So we've been doing a survey with APA for the last several years during the pandemic, really trying to get a pulse on what's going on with practitioners and how they're managing seeing this influx of patients. And what we found is that 41% of psychologists say that they're unable to meet the demand of treatment. And those with wait lists, if they can even maintain one, if they have the resources to do so, find that their wait lists are incredibly long. And associated research has shown that about 8 weeks is the current wait time to see a licensed mental health provider. Complex situations like this require multiple solutions. And so, as I mentioned, we do need to continue to find ways to support and expand the workforce. We need to be having a greater focus on prevention. We need to be thinking about how we change our systems of care to have more integrated behavioral health across the system, as well as new approaches and meeting people where they're at. But it's also clear one of those solutions has to be technology, and in particular, digital interventions that can support patients and mental health care providers in a variety of ways. So we really focus on how can digital interventions help increase access, so getting people the treatment that they need. And not only that, but reach of care, extending the reach of actual evidence-based mental health treatments. So those that have support and evidence supporting that they actually work and do what they say they're supposed to do. Of course, in addition to efficacy, we have to ensure that these products are safe for use, meaning that they protect your privacy and that they're not going to unintentionally do harm. And here's the most important point from my perspective as an APA employee. We see these as adjunctive support. So in no way are we advocating that technology should replace humans in any way, shape, or form. There will always be a role for providers, for the human, for the face-to-face kind of high-level touch that we need. But we have to be thinking about less of a one-size-fits-all approach. And instead, how can we use technology and digital interventions as tools that providers can use to help extend and do the work that they really want to do? So with that, I'm going to pause for a minute and ask the audience to complete a poll. I can see that we have a lot of people here from diverse backgrounds, and we'd really love to get a sense of how familiar are you with digital health interventions? So you have 4 options. A, not at all familiar. I've never tried or recommended a digital mental health program. B, somewhat familiar. Maybe there are 1 to 2 programs that you've recommended in the past. Moderately familiar. Maybe you have a little bit more regular use, but you're kind of still unsure what's safe, what's effective, what's secure. Or D, very familiar. Maybe you could even be up here in this panel giving this presentation yourself. You're very familiar, you know a lot about these products. So if you could just take a minute to complete the poll, that would be great. Just a reminder as people are completing that we have our Q&A box. We'd love for you to, in addition to letting us know where you are, start dropping some questions in the Q&A. I'll give it 1 more minute while I take a sip of water. And Peggy, I think we can probably close the poll. And so it looks like we're really in the A and B kind of area. So that's really, really fascinating. I'm glad that there's so much curiosity and all these people really wanting to learn more about this space, because I think education is one of the huge barriers to better adoption and scalability of digital interventions, because we just don't know. They're very novel, they're very new, and it requires us to really have a different mindset for how we think about delivering treatment and or receiving treatment. So that's great. So we'll be keeping that in mind as we keep going through. I got to do that. All right. So quickly, I'm going to touch a little bit on the digital health landscape, and then I'm going to turn it over to Dr. Carl. There we go. So really, when we're thinking about digital health, it's an umbrella category, which in some ways can be confusing because it can encompass a lot of different types of products and different types of tools. But when we look at what the FDA or the Federal and Drug Administration has to say, they're really thinking about digital health technologies as an empowerment for consumers, so you can make better informed decisions about your own health, and provide new options for facilitated prevention, which I mentioned earlier, early diagnosis, management of chronic conditions outside of traditional care settings. So again, it's this notion of meeting people where they're at instead of only expecting individuals who are suffering to come to us. We know that software and technologies can assist in diagnosis, treatment options, storing and sharing health records, managing workflow. And we really see these as not just increasing access to care, but efficiency in care. Because unfortunately, we are pretty inefficient in the care that we provide, whether it's mental or behavioral health care or healthcare in general. So when you look at the bottom part of the slide, you have 4 different boxes. So again, digital health can include many things like telemedicine. So with the pandemic, we've all become probably intimately more familiar with telemedicine. So that include providers with traditional kind of brick and mortar offices starting to deliver services via telehealth, whether that's audio, video conferencing, or just audio. But you also have these new online therapy platforms popping up like BetterHelp, which people are probably pretty familiar with. We also have things like wireless medical devices that can communicate clinical data back to providers to help them inform the treatment that they're engaging in and maybe make different tweaks or changes. We have wellness apps, which I'm going to talk a little bit more about in the next couple slides. And I think these three are in some ways much more familiar to us than others, right? And they all have an important role to play as we think about how do we address the mental health crisis. But I think for us at APA, what we're really focusing on and excited about is this growing space of digital therapeutics. We really believe that these types of software which deliver treatment interventions to patients has the huge impact potential to really address the mental health crisis and really get people the treatment that they need. So that's going to be the focus for my next couple slides. So what are digital therapeutics? So I've already alluded to it, but what we're talking about are software apps that deliver evidence-based therapeutic interventions on your phone or your tablet or your laptop. Now, because they claim to prevent, manage, or treat a medical disorder, they fall under the purview of the FDA. So these are not wellness apps. I'm going to explain the difference between the two in a minute, but these really deliver discrete, time-limited treatment module interventions to treat, say, insomnia or depression or anxiety. They can be used as standalone or as an adjunct product. Again, from our perspective, we really want to see them in some way have a human-supported touch because we believe that the research suggests that that makes them more effective. Unlike some of these other products, they do require a robust clinical evidence and real-world outcomes to support their efficacy. As I also mentioned, they're subject to some regulatory oversight, whereas some of the other products are not. And that hopefully will increase the efficacy, intended use, and privacy, and reduce risk. They may require a prescription or a clinician order, again, depending on what sort of regulatory model they've taken. And again, these are software, so they're not drugs, they're not biologics, they're their own product category, which probably is pretty unfamiliar to this group because they're so new. So again, I want to make this really important distinction between the area of wellness apps or consumer direct-to-consumer apps and digital therapeutics. I think this is where the majority of the confusion exists, at least when I'm talking to individuals about it. So if we start on the right side of the slide, I'm guessing many of these are pretty familiar to you. Calm, Headspace, MyFitnessPal, Noom. These are all what we consider consumer wellness or lifestyle apps. So they can be, downloaded by you, anytime off the App Store. They don't deliver a medical intervention. In fact, they're prevented from saying they treat or deliver a medical intervention. Instead, they teach skills. So as such, they don't fall under FDA oversight. There's no real requirement for them to demonstrate that they work. Anybody can kind of create an app and put it out there, use the, consumer star system to get people to use them and download them. And unfortunately, because there's no regulatory oversight, they're also not required to follow data privacy, security, or compliance standards. So you may be giving your personal health information on any one of these apps, and there is no requirement for them to keep that safe. And in fact, there have been some high-profile cases as of late where different types of apps or online platforms have sold data to advertisers and to others. Now, that's not to say that these don't have merit. There's a lot of really good use of these types of apps if you use them regularly. I use my meditation app almost on a daily basis. I used it before this presentation just to ground and center myself. So I think these absolutely have a place in healthcare. But we also need apps that actually deliver treatment. And that's why we think digital therapeutics are so exciting. Again, they're the software that delivers the intervention to the person in their home. They have to demonstrate some efficacy requirements. There's lots of talk about whether these requirements are of a robust standard enough, and we'll get to that later with Dr. Schuler's presentation. But they are held to similar standards as other types of products that the FDA oversees. And thankfully, they also required to follow privacy, security, and compliance standards like HIPAA. Okay, so that's pretty much concluding my section. I'm right on time, which is excellent and hardly ever happens. But here's the takeaway I hope you have from this particular section, which is to remember the title of this presentation, that not all apps are created equal. But I hope that you are coming to this again with a sense of curiosity and open-mindedness and thinking about how can you make decisions as either a provider or a consumer to incorporate some of these digital tools into your treatment programs, into your lifestyles, into ways to help you reduce suffering, improve your emotional well-being, because I think as a result of the pandemic, have a new appreciation for just how critical our mental health and our emotional well-being is and how it relates to our physical health. And so with that, I will stop. I'm going to be the one that keeps advancing the slides. So you're going to hear, next slide, please, a bit. But with that, I'm going to turn it over to Dr. Carl.
Thank you so much, Dr. Wright. That was such a great introduction. I just found myself enraptured listening. So I want to pick up from where Dr. Wright left off to dial in a little bit more to digital therapeutics specifically, the more the category that has sort of greater requirements and definition around it. And I want to talk about the role that clinical psychologists currently play in the development and distribution of digital therapeutics, and the role that I hope that they really continue to play, because I think it's ultimately very critical for both our profession and for the well-being of patients in the world, for us to continue to be very involved here. So Vail, you can go to the next slide, please. So there might be a little bit of a lag. There we go. Wanted you all to see that beautiful picture. So ultimately, there's a wide variety of digital therapeutics available today, some for mental health conditions, but there's also many for chronic health conditions. You'll see a lot for diabetes prevention, for example, some for heart disease, things like that. Coping with cancer is another area that you see frequently. And what is uniting about these programs is that they're almost all based on psychological science or like behavioral medicine. So behavioral and psychological approaches to treatment. Things like cognitive behavioral therapy for insomnia, CBTI, or mindfulness and acceptance approaches to dealing with pain, chronic pain, breath training, biofeedback programs for panic attacks and panic disorder. And so they're based on that, but then they're adapted to fit a digital delivery format. And frankly, that level of adaptation can be really heavy, and where the design and adaptation really becomes a novel program, and what I've sort of started calling like a digital native treatment. But there's also some programs that are much more of sort of a direct translation of a treatment manual into an app, where it is really almost, it's more like reading a workbook, but you're doing it on your phone. So there's different levels of adaptation, but ultimately the core fundamental treatment approaches are psychological ones that are focused on producing patient outcomes through psychological and behavioral mechanisms of change. And that is very novel. And the reason is because these digital therapeutics are regulated as a medical device by the FDA. And it's probably the first example of a class of medicine regulated by the FDA that's based on psychology. And so why that's important is historically psychologists have not been involved in as much in medical device or FDA and some of these worlds. And so there is a lot of sort of new opportunity and like learning together that we really need to do to continue to support the development of this field. So moving to the next slide. I just want to talk a little bit more about the development and the development of digital therapeutics, essentially. So they can be developed in a range of settings: academic clinics, nonprofit institutions, healthcare companies. And wherever they're developed, typically psychologists or other behavioral medicine, behavioral treatment experts are involved in the initial treatment design, right? Because it comes from our profession's approaches. But beyond that kind of initial treatment design, to meet the full criteria for a digital therapeutic, which as Vail discussed, involves really high demands on clinical evidence. That includes randomized controlled clinical trials, demonstrating safety, efficacy, and effectiveness. It entails high standards for quality, for security and privacy, which we can talk more about. And I did see there's a question in the Q&A, and that we'll make sure to come to that in the Q&A because I know it's a big question. And so because of those greater requirements, it's actually very time and resource intensive to take a nascent digital treatment to that level that is required by FDA, and that meets the definition of a digital therapeutic. And as a result of that, you typically see digital therapeutics really being taken on for broad development and distribution by companies that have the knowledge and resources to do all of that work, which involves a lot of interdisciplinary professions. So it involves people that are deep experts on the product and technology side and security and data side. It involves deep experts on the user experience and design side. I mean, how people interact with digital formats is very specific, and it's not something we can just infer from how we interact with a patient sitting in front of us. Additionally, it involves people on the quote unquote commercial side, where they're thinking about how do we secure the right health insurance payments by the right types of providers that should be delivering these treatments, or how do we actually market these treatments, who's the right patient population. So there's all these interdisciplinary teams that work on digital therapeutics. But what's really interesting to me and important to me, and I see this in the company I work in, is that the clinical professionals, often psychologists or can be psychologists, they really have an opportunity to deeply influence all of these areas. And so they're not just involved in the kind of core design of the therapeutic, but they're involved in informing how it should be regulated and the quality system. They define what are the clinical risks that need to be managed. They establish the correct kind of risk management and reporting standards. Of course, they also define what the patient support should be and what that should look like, what the research is that should be required for both understanding usability for patients, as well as demonstrating safety and efficacy. And then they can also do a lot of work on what, in terms of communicating and translating in fair and balanced ways, like what the program's benefits are. They can do a lot of work on the policy side to kind of influence how they should be processed and paid for and things like that. So there's many, many roles that are appropriate and helpful for psychologists to play across the distribution and development of therapeutics, not just the initial design or that final, delivery to the patient. Moving to the next slide, ultimately, because digital therapeutics are considered true medical interventions that need to deliver safe and effective care and meet a variety of clinical and regulatory requirements, it's typical that psychologists or other clinical professionals are deeply involved in that end-to-end development process. So now I'm sort of talking about, taking the product from that initial stage of development through to actually distributing it to, say millions of people, potentially billions of people. And that process, from sort of left to right on the screen here, it includes things like initially defining the target patient population, creating a plan for cultural responsivity, creating the actual design and content, creating safety protocols, defining what the contraindications should be, designing effective clinical trials to establish safety, efficacy, and effectiveness. And then once a therapeutic is actually being used in the real world, clinical professional support, safety monitoring and reporting, which is required by FDA or other clinical bodies. They develop marketing materials that are fair and balanced and accurate. And they help in an ongoing kind of iteration of the programs to make sure that they're continually improving and evolving. One thing that's different about software-based medicine is, unlike a pill, it can't stay stagnant. Tylenols had the same formulation for I don't know how long, but maybe hundreds of years, and there's slight improvements probably to the wrapper so that it goes down smoother, but ultimately it hasn't needed to evolve to be effective. But that's not true of software-based interventions, because technology changes and how people interact with technology changes. And so therefore, the whole patient interface and experience ultimately needs to be one that is open to change and evolving to kind of meet that patient need. So there's a long kind of ongoing tail that psychologists are also involved in that development of the therapeutics. And so I wanted to talk a little bit more, give you more just like a look and feel at a high level of a digital therapeutic. This is one that I helped develop at my company, Big Health. And this is called Daylight. It's a digital treatment for GAD. It's based on CBT principles. My background is in anxiety treatment development and outcomes research. And for this program, I worked really closely with a team of outside psychologists that were also anxiety experts, and to create like an initial version of the program. And how we did that was through distilling the desired end behaviors that we wanted patients to acquire. And then we went through a really fun and creative process with storytellers, designers, animators, voice actors to create exercises and techniques and a patient journey that we felt would really strongly, in a digital context, help people to symptom improvement and recovery, leveraging those core CBT underpinnings. But this was more of a digital native design to really encourage patient engagement. And over time, of course, we've had a number of other anxiety experts continue to evolve and improve the program. You know, and other pieces of the program, of course, include standardized assessments for symptom monitoring, thinking about what we can, how we can design the patient experience to promote engagement and motivation, and thinking about what's important in the context of the healthcare environments that these programs might be used in. So I say this because you can see that there's a number of different considerations here in the development that are critical to making the program effective in the context that it's used. It's critical to it being effective as a digital intervention. In particular, this is meant to be self-guided, but certainly can be used and should be used with the support of a psychologist or a mental health professional, as is appropriate for the individual. And moving on to the next slide, I'll just close out by saying that ultimately these products, these digital therapeutics, are, I hope, are all in the service of really extending and supporting psychologists' capabilities. And so, for one, they should be able to help psychologists identify digital treatments, digital interventions that they can trust, that they know have strong clinical evidence backing them, that they may have, that which may even include like clinical bodies that have evaluated and recommended them, that has FDA backing them, that meets international standards for security and privacy and quality. The other point that's important is that these type of programs are intended to be reimbursed by health insurers. Now, we're not all the way there to having them fully reimbursed, but many of them are reimbursed by, I would say all digital therapeutics are reimbursable by some different types of health insurers. And so that's something that will continue to evolve, but this is not to support psychologists, this is not something that patients should be having to pay for fully out of pocket. It's not something that psychologists themselves should be paying for. It should be a part of reimbursable healthcare, like any other type of healthcare. And then because of that, it can help psychologists really support their care with patients. And so it provides, between session tools that people can access 24/7. That also includes more real-time prompting and techniques that people can use in those moments where it's hard for psychologists to be with them. And it can help psychologists focus on addressing areas that they may not have time or expertise to develop, to focus on in session. And they can use their session time to really do what's best in the session and focus more on the human element, the motivation, rather than some of the like exercise or technique focus, which can in some ways be better applied in the moment or better applied through a digital support tool. So there's ultimately a variety of ways that digital therapeutics can be used with patients. and Dr. Schuler will talk more about that, but they are intended to really support psychologists to deepen their practice, cover more patients with more tools, and offer, different types of treatment options that really meet patient preferences. So I would say that, I think my takeaway, for all of you is that psychologists are essential to the good development of digital therapeutics, to the appropriate delivery of digital therapeutics, the appropriate regulation of digital therapeutics. And I think that this has an opportunity to actually really expand the role for psychologists within healthcare today. Because as I mentioned, this is the first time psychologists have a tool that is regulated by the FDA, that is something that can expand their practice in a different way, rather than just additional hours of their in-person time. And they're being integrated, all over in healthcare today. And so it gives an opportunity for psychologists to continue to kind of expand their reach, where they're plugging in, and what treatment options they have for their patients and their practices. So I'm just very excited to continue to see psychologists just play a deeper and deeper role. And that's really what's going to allow the field to move forward in the right way and serve patients in need the right way. So with that, let me pass it over to Stephen for the next section.
Fantastic. Awesome. Well, thank you, Dr. Carl and Dr. Wright, for really setting up the background and I think some of the use cases and really the role of psychologists. And I want to emphasize and underline that. I know Dr. Carl just finished with that, but to me, I think what's really exciting about digital therapeutics is it really expands the capabilities of psychologists to really be impactful. Psychologists can be involved in the design, they can be involved in the delivery, and they can be involved in the evaluation. I'm going to be talking about evidence and evaluation criteria. And so I think that these digital therapeutics really have an important role in us being able to promote better mental health and mental health care for all. And so I think that it's really exciting for me to see so many people in this webinar, for you willing to spend your time to learn more. And I know I am what's standing between us and some vibrant conversation. And I appreciate everyone who submitted questions in advance, as well as questions currently, and just remind you to continue to put some questions in the chat. So I'm going to be talking about evidence and evaluation criteria. And I think that evidence is a really important aspect that goes back to the title, as Dr. Wright sort of underlined, which is that not all apps are created equal. And I think because not all apps are created equal, I think we also have to appreciate that they can play some different roles in our clinical delivery pathways. And understanding those different roles is really important, I think, to think about what evidence is necessary and how we might use evidence. So I typically sort of see three buckets of potential uses of digital therapeutics. There are digital therapeutics that are used as standalone tools. So these are digital therapeutics that are used to provide treatments for individuals who may not receive treatment otherwise, or maybe to prepare clients for treatment while they're on a waiting list, or to follow treatment. So after they've received some traditional face-to-face psychotherapeutic support, it can be a follow-up treatment that might be able to help them maintain their gains, or maybe approach a different area that they weren't able to do in that treatment. So we do see some role for these tools as standalone products. And we also see digital therapeutics being therapeutic adjuncts to provide additional therapy skills. So as an example of what I mean by therapy adjuncts, I'm trained as a cognitive behavioral therapist. I've done a lot of work in depression, anxiety. I've not been trained to do cognitive behavioral therapy for insomnia. So if I have a client who comes to me and I'm working with them and they're dealing with some significant insomnia, in addition to depression, I would feel comfortable treating the depression. I understand the principles of cognitive behavioral therapy for insomnia, but I might need another extra tool in my toolbox to be able to really help support them in treating that insomnia. So I might pick a therapeutically consistent, in terms of my conceptual model, tool, like maybe Sleepio, that I could give them that could help deal specifically with the insomnia to provide that specific treatment. And I can follow up and check in on it in the treatment that I'm providing. So it's a therapy adjunct, sort of an added module to maybe target some of the other challenges that they're dealing with that I don't have the expertise myself to deal with as deeply in sessions. And gets around the challenge of maybe finding an expert who knows cognitive behavioral therapy for insomnia, who maybe isn't even in the geographic region or wouldn't be able to be referred to for that specific client. And then lastly, they can play a therapy extender role, which is to support evidence-based practices through lessons, homework completion, and other features. So kind of emphasizing, as Dr. Carl mentioned, is it allows me more time in the session to focus on the things that are most impactful and can provide some additional tools that are consistent in, with what the treatment is that I'm providing. So really allowing some of the work to happen outside of the session through the support of that digital therapeutic. And I think, at least in terms of the evidence and what we know from research, digital therapeutics tend to be most impactful when they're used in conjunction with some form of human support. I'm really thinking about the connection between psychologists and other providers in a digital treatment is where we see the most impacts. And so, again, I just really want to emphasize that getting more knowledge about the role of these tools and how they intersect with our practice is really important, because we still, as providers, have an important role to play in the delivery and the evaluation of these digital therapeutics. Next slide, please. So I want to talk about a little bit about the regulation of digital interventions. And, as Dr. Wright mentioned earlier, digital health is sort of a broad umbrella term that includes a variety of different products. They could be telehealth products, they could be wellness products, as well as digital therapeutics. Many apps, many digital health products actually fall outside of FDA's regulatory oversight, or the FDA has chosen to exercise enforcement discretion over certain sets of products. And so products that fall outside of the FDA regulatory oversight, or where they've said that they're going to exercise enforcement discretion, are tools that help people self-manage their conditions without providing specific treatments or treatment suggestions, or tools that help provide people with simple tools to track their health information. So, just trying to think about like what's different about a digital therapeutic than a wellness product. Digital therapeutics are interventions that are providing specific clinical interventions for specific clinical outcomes, and therefore do have a higher evidentiary standard that they're held to. So I think that, this language helps me sort of think a lot more about like, well, what is the thing that differentiates a wellness product from a digital therapeutic? I'll also say that FDA regulation is not sort of sufficient to understand everything that's going on in this space. And there's a couple of reasons that that's the case. One is that back in 2020, the FDA actually relaxed their regulation of mobile psychiatric products due to the COVID pandemic, the increasing demands of mental health challenges that arose back in 2020, as well as the need for more remote and virtual care. The FDA sort of relaxed their regulation of these specific products. Regulation is now shifting back, but there were some products that were released to the market, made available to people during that period of sort of relaxed regulation. And I think also, just note that, not everything that fits under this sort of digital therapeutic umbrella has currently received sort of FDA clearance. So I think that, although FDA is useful, FDA is not completely sufficient to sort of understand, what counts as a digital therapeutic and what does not. And there's just some examples of here on the left-hand side of the slide about some products that have been cleared by FDA through their regulation. Can you go to the next slide, please? So I think, I also want to note that, FDA regulation is not sort of evaluation by clinical bodies. And we have a lot of different examples, especially in other countries, of evaluation and regulatory processes that are helping sort of understand the clinical evaluation of some of these products. So I think one good example in the UK is the National Institute for Health and Care Excellence. And they actually have a couple different models of the ways in which they're evaluating products. So one of the things that they do is these early value assessments, which means that they have identified products that meet certain thresholds, but require some additional information before they can recommend it for use within their clinical guidance specifically. And so for some examples of some products that have received early value assessment within the area of anxiety and depression, you can see that there's a list of a couple different ones that they've noted: Perspective, Beating the Blues, Space from Anxiety, Deprexis. And I think that one thing that's important that comes along with the NICE guidelines is that they also have care pathway recommendations that help us understand how these tools might be able to be used in delivery pathways. So guidelines and help around deciding what treatments to initiate and when to decide to use a digital therapeutic, perhaps versus other treatment options. How to match the treatment to the needs and preferences of the client, because again, there's not one product that's going to work for everyone. And so we really do have to consider whether a digital therapeutic might be the best fit for a specific client that we're working with. And also recommendations to review and evaluate how the treatment worked after 2 to 4 weeks to make sure, similar to giving someone a prescription for medication, that we check back and make sure that they're actually getting the clinical benefit that we would expect from that. And this sort of early value assessment is similar to some processes that have gone on in other countries, like the DGUT in Germany, that actually allows an evaluation threshold to look at some products that actually we want to spend some more time collecting clinical evidence for before we're able to recommend it, but allows us to sort of look at promising products that have met certain thresholds of safety and security, so we can further evaluate their efficacy. Next slide, please. So I think in terms of selecting digital interventions, and I think that this intersects well with thinking about what evidence is necessary, this is a model that I really like, in that, you know, the first step that I really see is that we have to narrow. There are a lot of products out there, you know, multiple digital interventions, and sort of as noted by the poll, I know some of you have, you know, maybe used one or two, so you have some knowledge, but I know it can feel overwhelming. And so I think that one step that's really useful is to narrow and look at sort of a subset of products, and then to allow you to explore those products so that you can understand, you know, is this a product that you actually want to use with some clients that you're working with or would recommend? And what does that product actually do? And so I think in exploring, and I'll emphasize this a little bit more on the next slide, aspects that come into consideration there for evidence is looking at credibility, or the research or clinical evidence supporting it, data privacy, so concerns around security and privacy, which I know are present in the chat, as well as user experience. It's an app that's easy to use, easy to learn, and something that matches with the client you're working with. And then lastly, our role as psychologists is then to contextualize that product for an individual in terms of how it might be useful for them, their life, and what they're dealing with. And then lastly, to recommend and reevaluate, to reconsider whether that product is actually working for them. And again, you know, similar to the NICE guidelines, to maybe consider within 2 to 4 weeks, like, is someone actually benefiting from it? Are they using it as expected? Are there things that come up in doing so? Next slide, please. So in exploring digital interventions and thinking about the evidence that's necessary and how we might evaluate these things, you know, there are multiple different evaluation criteria that are out there. I think across evaluation frameworks, I think there are 3 buckets of things that we usually see as consistent. There's some need to understand what is the clinical evidence, where is this product indicated for, both in terms of target conditions and populations. What is the user experience like? Is this something that actually would be usable by the population of clients that you're working with? And then considerations around data security and privacy. And I think it's useful to think about, you know, different categories of things rather than, you know, is this a 5-star app, as we often get baited into doing by the app stores, because there's really no magic number, because there is no one app solution. There's no tool that's going to work for everyone. And so I think understanding that in different use cases and for different people, the considerations of credibility, user experience, and data security and privacy might play out a little bit differently. Different factors are important for different people, and different things will work for different people. Next slide, please. So I just want to point us in terms of closing to other resources that might be helpful for clinicians. I know this is a webinar that is hopefully providing some knowledge and skills, and I know that we can go a lot deeper in this area. Through some of the work that I've done, we've provided some different guides for digital solutions that include both wellness apps and digital therapeutics, both for employee mental health and employer's guide, as well as teen mental health through the work at One Mind Cyber Guide. I also want to call out the Society for Digital Mental Health if people are interested specifically in this area. And APA has, in addition to this webinar, has done a host of really useful information, including their Let's Get Technical column that's available from the APA website. So I think that these are a couple different resources that if you want to go deeper, if you are interested in this area and you want to learn more, it doesn't stop today, it continues to go on. And with that, I think I will conclude, which will bring us to our Q&A.
Thank you so much. I will pick back up here to help guide us through the Q&A. And thank you so much for putting in all the wonderful questions. I think we've got a good chunk of time, so we'll try to get through as many as we can. Trying to answer a few by text, because I'm sure we won't get to all of them. But let's start with, I think, a big one that's come up from several of you, and that is really around privacy and security. Vail, would you like to take a first pass at answering how people should think about privacy and security in a digital context, and sorry, or Stephen, I think I actually put you down for this one.
Okay, Vail can start.
Okay.
Thanks, Stephen. Yeah, I mean, I think, when I'm talking to the media or consumers about what they need to be looking for, this is the one thing that I try to focus on the most, because I think it's the thing we don't think about. We're really often focused on, does it work? Will I like it? But really, you need to be thinking about, where is my data going? How is it being stored? Is it being sold? What data am I offering over? And how do I ensure that it doesn't get into the hands of people we don't want it to? So at a very minimum, we suggest that individuals look to see what are the privacy and security types of agreements that you're signing to. What do they have in place to ensure your data, and to read the fine print. I think we very often just click yes when we see these long lists of legalese around our data and privacy, and I think we need to move away from that, because I think it's not doing us much of a service. I'll kick it over to Stephen. I'm sure he has much more in depth to say, but I will say, from an APA perspective, there are multiple things that we are trying to do to advocate to ensure privacy around digital health. That sometimes includes going directly to the product makers themselves, helping them with their terms of service, ensuring that it is protecting health the way we want it to. It's also we also write a lot of advocacy letters to either the White House or CMS or other bodies, ensuring that they understand why PHI within mental and behavioral health care is different, and why it needs special considerations beyond those that already exist. But I think right now, in a lot of ways, it's still kind of the Wild West, and it ends up being in the hands of consumers and providers to be able to figure out what works.
Yeah, I'll just say, I think that one starting point is to appreciate there is a difference between wellness products and digital therapeutics. So as Dr. Wright sort of talked about in her portion, wellness products are not really held to a lot of different standards around these things, and they can actually change even what their policies are in terms of what they're doing with your data even after you have it. And there's been some cases of that. In the work that we've done where we reviewed wellness products, we did a review of about 120 different wellness products that are related to some aspects of depression. And we found that about half of those didn't have a data security and privacy policy whatsoever. So I think actually, like, reading the documentation is really helpful. I think, when we see digital therapeutics, and ones definitely that are dealing with, patient and client data, really making sure that they've gone through HIPAA protection and have some other, protections related to it. And I think that usually that is an evaluation process that happens in FDA evaluation or other, evaluation guidelines that happen around the world. So I think also looking to various regulatory bodies is really helpful to see, different work that's done in terms of the diligence of the assessment of the security of one's data.
Yeah, thank you both so much. A couple other things I'd add around that. It's the title of the talk. All digital images are not created equally. Like, that will be one big area of difference, is the level of robustness around privacy and security. You can look for the contact information of a security officer. That's important and generally a good signal. You can look for things that indicate they would have a high level of testing. It's called like penetration testing, which means that they're actually testing against being hacked for people's data. There's a certification called HITRUST, which is kind of the standard in the field, which indicates that people are performing that penetration testing like every year to a rigorous level that is actually externally certified. So there is definitely a higher level of quality here that you can look for, but it does take really looking through those privacy terms to start to kind of suss out those details. FDA clearance requires all of that. So if a program is cleared, you can know that there is a very rigorous level behind that, and then anything under FDA oversight generally should be trying to meet that as well, even if they don't have clearance. Another question that came up was in a couple places was around whether digital therapeutics are covered by insurance. And I'm happy to take a first pass at that, and then would love for Dr. Wright and Dr. Schuler to jump in. But one of the differentiators between digital therapeutics and consumer wellness apps is that there is ideally healthcare reimbursement or coverage for digital therapeutics. Now, the problem is that this is not universal. It's not become the norm in healthcare today in the US. So it's quite uneven right now. But there are many different large health insurers that have made decisions to cover different digital therapeutics for their member population. And so as a patient, as yourself, you can contact your insurer to find out whether you are covered for certain digital therapeutics. They can also be covered as like a pharmacy benefit. So that is another way they can be covered. And so ultimately that it is happening that they are covered, and that is the goal. But there is also, we're not all the way there yet, and we expect there to be and hope there to be better and new coverage coming from the Center for Medicaid and Medicare Services, which would enable coverage for everyone, more on parity with other types of intervention. And so that's some work that I'm supporting and advocating for, and APAs as well. So I'll turn it to Dr. Wright to add anything more around that as well.
Yeah, a lot of the way reimbursement works is via CMS. In terms of scalability. So, even though you may say to yourself, well, I'm not a Medicare provider, it doesn't really matter to me what happens at CMS level. When Medicare decides to cover, then often third-party payers follow suit. And so we've been working really hard advocating on both the Hill and directly to CMS to identify a reimbursement pathway for digital therapeutics. In their recent physician fee schedule that came out this past summer, they had a request for information for public comment on how we could identify reimbursement pathways for digital therapeutics, and particularly digital CBT, which of course we responded to, and we collaborated with many other like-minded stakeholders to also respond, offering up ideas on how we might be able to better cover these products so that everybody has access to them, not just certain payers. We've also seen some movement at the state level around Medicaid coverage, which of course we also support as APA, and we've been working with our state psychological associations to be on the lookout for legislation that may come through in the next cycle and how they can advocate for broad coverage within Medicaid across these different products. Because, from our perspective, it's not just one product that needs reimbursement. We need to find solutions that cover the variety of different products that exist that are under the realm of digital therapeutics. So again, the ones that have demonstrated their efficacy and their safety. And I think we're making inroads, but it's going to take still some more time. But know that APA, this is a huge priority for us, as is reimbursement for mental behavioral providers across all of healthcare, but this is a particular area of focus.
Yeah, thank you. And there will be, look for, more information coming, but the hope is that this should be beneficial to psychologists as well from a reimbursement standpoint. This is all very new, but if it follows similar models, there's an opportunity for the psychologists and the people providing the digital therapeutics to be reimbursed for their time doing that, and even to really share in the cost of the therapeutics themselves, such that it should be beneficial. And I know that there was comments in the chat about how hard it is doing just all direct clinical care to really get to a good level of personal income and all that. So hopefully this all helps support psychologists in their profession, in their practices. Moving into another question here, I think Dr. Schuler, this would be a great one for you. Someone asked where psychologists would find a list of digital therapeutics or how they should look at what's available in the field.
Yeah, I think that's a complicated question, at least here in the US, because we don't have, bodies like NICE that are really doing sort of regulation and approval in the same way, and recommendations, I should say, in the same way that they're doing over there. I think that FDA has cleared some products, so that provides some list of things, but as I mentioned, it's not sufficient to cover everything. I think another thing, and unfortunately, this goes off of what Dr. Carl's point was, and this kind of mirrors what we've done in face-to-face, but different insurance companies are covering different things or providing different things. Like I have a digital therapeutic that's available to me through my insurance coverage, but I have one. And so I think like there's still a challenge in terms of what even might be available or for specific people. So I really think that and it constantly changes too, I think, is another thing. This is a very fast moving space. So I think that really the advice I would give to folks is to like really stay involved in organizations like APA, go to webinars like this, form communities of practice and learning communities around people who are interested in this. And I think I plugged the Society for Digital Mental Health as one sort of specific, I think, learning community that can be potentially useful for practitioners to stay up in this. But unlike the NICE, where I showed you that list of like, here's they have Sleepio, which is for insomnia, has been follows NICE guidance, and in depression anxiety they have these ones that have met the VMA threshold. Like we don't have that here in the US in the same way.
Yeah, thank you. And one tacking onto that, one person asked, how would I get access to Daylate, for example, the program that I just talked about? And it's a great question. So right now, like Daylite and other programs that Big Health makes are offered by some insurers and not others. And we're really trying to make sure that they are covered by healthcare. We don't think that we don't want mental health programs to have to be something that people pay for out of pocket. So we're doing a lot of work to make sure we can extend that coverage. But in the meantime, unfortunately, they're not available for all clinicians to provide to their patients in that way. So what I would recommend is on the Big Health website, there's a page for clinicians who can basically, you can sign up, put your name down to kind of stay abreast of news and information, possible ways to access those programs. And we're doing everything we can to kind of extend and make and create that access. But it's still a little bit of a complicated landscape in the US. Another great question, which I saw in a couple of places, were questions about using digital therapeutics with teens and children. Dr. Schuler, I think would love to hear if you have any suggestions for how people should think about that.
Yeah, I mean, I think that there's a lot of excitement because teens and kids, they're digital natives, they're on technology a lot. It's a very appealing way to sort of reach them. I would say two things have really come up in our work around this area that I think are really critical to think about. I think one is like just the user experience. Kids have much higher expectations around what technologies can do than adults. And so really making sure it is a user experience that is simple, fun, and engaging. I think we see some things that are going on in the digital therapeutic space, like Endeavor RX, that's been cleared by the FDA, that has this more gamified model to work with kids, and I think that that's really exciting. I think the second thing is like they really need to be products that meet kids where they're at. They can really see through if this was not a product that was designed for kids and with kids, and making sure then that there are examples that are present there. And like, again, that's similar to what we do in therapy. I'm not a child psychologist. I don't work with kids, and that makes a lot of sense. And so if you have a digital therapeutic that's really not designed to meet kids where they're at, I think that that's not a great suggestion in terms of what they might use. So I think thinking about those considerations around really about the user experience, is it kid friendly, and like, is it actually a tool that's designed for kids, I think are two important indications.
Thank you so much. I think we're just at time, and unfortunately there's so many questions we didn't get to, but we're just so glad to hear them and your interest. And Dr. Wright, I don't know if you have any last thoughts to close out, or instructions for folks who will, may continue to have questions in this area.
I do. Thank you. One is, yes, there were a lot of questions we didn't get to answer, but we have some of these answers on our website, which is, we're currently revamping, but there is a page that exists. So if you go to apa.org and you type in Office of Healthcare Innovation, it'll take you to our page where, again, we're building out a really robust education plan around digital therapeutics and other digital interventions. So I encourage you to go there. Also, you will be receiving a survey at the conclusion of this webinar. Please take about a minute to complete it. It doesn't take long, and you can provide us some feedback on how you felt this went. You can let us know what additional topics you would be excited to hear about. We really do look at these and use these to help us guide the programming that we do. So with that, I'll end and say thank you to Drs. Schuler and Carl for being on this panel today, for everybody for being in the audience, for APA and for the Big Health staff for helping set this up, and I wish everybody a great day.